Hey everyone, it's Dr. Jory and welcome to the Hybrid Health Podcast. My goal is to bring you the best minds in health and fitness and help you live a better, healthier life. Hi everyone, this week's guest is Kara Leung. She's a registered massage therapist at my clinic here, Hybrid Health and Fitness in Toronto. And we talk about massage therapy, we talk about cupping.
Yes! That's awesome!
Discuss 10 interesting gym characters. We check in with Dr. Stefan from Botswana with his deep thoughts. And Kara gives us some good exercise advice. If you could do me a favor and hit that like button and subscribe to my channel, I'm going to be sending you lots of these episodes in the future, and all to help you with your health and fitness. Let's get you to the show. Enjoy. My guest is Kara Leung. Is that how you say it?
Yes, Kara Leung, I think. I'm not too sure if I said it incorrectly myself.
That's funny. So she is a registered massage therapist within our clinic here, Hybrid Health and Fitness in Toronto. And thanks for joining us, first of all, joining me.
Thanks for having me.
And let's start with what got you into massage therapy in the first place.
So I kind of got into massage therapy from being a personal trainer in the first place. So I was not always into fitness. At one point I was like under 100 pounds in university. And after going to the gym, you kind of become almost like addicted, but maybe not in that extreme way, but to becoming stronger. And so I fell into personal training first, and I felt like massage therapy was like almost like another tool that I could have that actually goes hand in hand with personal training, because I actually found some of the personal training clients that I had, some of the more difficult people to train were those with poor mobility. And so for myself as a trainer, I found it was pretty difficult to even train those people if they couldn't do a proper squat, just because literally they can't physically do it at the moment. So
Right.
I think it was a good gateway from personal training into massage therapy. So it just kind of went hand in hand, and I found like it was just a great addition to my toolbox.
Nice. Sorry to distract with my little
No.
bark bracelet there.
Yeah.
So then you started out as a personal trainer. When did that, how old were you there?
That was after I graduated university. So I came from a kinesiology background.
Oh, okay. And that was at what school?
I went to University of Waterloo.
Okay. So it's pretty heavy science.
Pretty heavy science for sure. And I also did co-op there, so I actually followed kinesiologists as well as physiotherapists and chiropractors as well.
Oh, nice. Okay. So you got into personal training first, and then you got into massage therapy. So what school did you go to for massage?
Massage therapy, I went to Sutherland Chan. It's a pretty big school.
Yeah.
Again, it is actually very, very thorough, and it was even more as thorough as university. It was
Really?
very
Nice.
yeah.
I've heard good things about that college being high standards and all of that.
For sure.
Now, so you did your 4 years Bachelor of Science Kinesiology, and then you did, what is it, 2 years? For
myself, because I had an undergraduate degree in
Right.
something that was related, it was just a year. So you would call that an accelerated program.
accelerated program,
Yeah.
because you had taken things like anatomy,
Yeah,
physiology,
Yeah.
stuff like that, which comes in handy, obviously.
for sure.
And then how long have you, so you started out working at Good Life Fitness?
I did, yes. And I actually also worked at a women's gym as well.
Right.
So I did the two together, and I was actually working at the women's gym as a personal trainer while I was in school for massage therapy.
Okay.
So
Yeah, I see Kara out on the gym. We have a really big gym just outside our door here. And I see Kara out there all the time. She
All the
works
time.
so hard. And she lifts heavy.
yeah.
Right? Now, along that topic, nice little segue into a new segment that I'm going to call blog posts. And we're going to look at some blog posts that I've made over the years. This one's going back into the archives many years. And it was an article that I wrote called 33 Interesting Gym Characters.
You got to shock the muscle.
Now, the reason I wrote this is I have spent now, I started working out when I was in grade 9, and I've been in the gym ever since. And then I've been working within gyms ever since I graduated. So for the past 13 years, I've been working within gym settings, and I've seen all kinds of weird, interesting characters. And this blog post is not to make fun of people. It's to celebrate the variety of people that come to work out. Now, there are some sort of, I would say, generalized types of people that you can find at the gym, and I'm sure you've seen many.
I'm pretty sure I'm more than one of those myself.
Exactly, and I am also one of the people that I'm talking about in this
Sure.
post. So what we're going to do is, because it is 33, we're not going to go through all 33. We're going to go through 10, and then in future episodes we'll cover some of those other characters. So we'll start with the Sweat Angel. Okay, Sweat Angel. Think of a snow angel, but transfer that to the workout mat. This person leaves their sweaty outline on the mat for the next member to view in disgust and astonishment. Have you ever seen Sweat Angel?
Oh, for sure. If you go to almost every bench, a lot of people don't usually clean up after themselves. So
that's a pet peeve of mine.
Yeah.
You don't want to go, lay on a bench that has someone else's sweat on it. So that's completely fine if you're a sweat angel. Just clean it up.
Yeah,
right?
for sure.
It's easy. Okay, so that's number one. This one, super related to the sweat angel, I guess, is the sweaty person.
That's me.
The sweaty person. You're one of the sweaty
I'm a
people.
sweaty person.
Okay, and there's, again, nothing wrong with any of these. It's just fun to talk about. So everyone sweats when they work out, but this person has a little extra oomph in their sweat glands, leading staff to follow them around with yellow caution wet floor signs on the ground.
Yeah.
Has a staff member ever put those signs behind you after you work out?
Luckily, what I always do is when I'm on a bench, I grab a mat, and so I put the mat on the bench, or some people use towels. And then after, I would kind of just wipe the mat down, because I would bring the mat from place to place, and that's kind of an easy way to...
That is a great idea.
Yeah.
Just lay the towel down. They give it to you at the front desk. Lay it down,
Yeah.
and then you're good to go.
Yeah, you don't even just
Creates that barrier.
wash the towel after.
Exactly. Okay, also kind of related there, which I've been known for this sometimes. It is the smelly person. Everyone smells after they sweat, but this person has a little extra oomph in their, lost where I was, body odor. Unfortunately, they are oblivious to their own brand.
I'm sure I'm like this person too from time to time,
I've never
especially when I'm
noticed.
sweating pretty hard.
I didn't notice.
And you know what? One thing that I'm kind of blessed with as a massage therapist is I have a very poor sense of smell.
Oh,
Which
that's
is kind
good.
of like, but I wish someone would tell me if I kind of didn't smell the best. But luckily, when I treat people, and I don't notice.
You know what I think the biggest problem, or the biggest cause of the smelly person, it's not the person themselves. It's that they reuse the same workout shirt without laundering it. Okay, I've done that
Oh,
a few
yeah.
times.
Who hasn't?
So you keep wearing that same shirt, and of course bacteria is going to get growing in there a bit, and then you throw it back on a couple days later, go do another workout, it starts really stinking. So, key point, do your laundry, don't keep re-wearing those shirts. And nice segue to the same shirt wearer.
Mm-hmm.
That's me. I am for sure the same shirt wearer. I will pick one shirt that I really like to work out in, and I don't want to work out in any other shirt. And so that leads to the problem that I just said, which is not laundering my shirt in between workouts.
Mm-hmm.
So it's could be the same person as number 3. They love their workout shirt, even though it has permanent sweat stains and frayed edges. So that's definitely me. Okay, next up. Speaking of smells, we have the cologne/perfume person. Could be an attempt to avoid being labeled a smelly person, or trying to attract a workout partner. This member goes a little overboard on scent. May also show number 27 tendencies. So we'll have to wait to find out what number 27 is. So, cologne perfume person, is that you?
No, just my own personal smell and my own deodorant.
Okay.
Yes.
Good, but you have noticed sometimes.
Oh, for sure. I think like even when you're not in the gym, you can notice that people kind of overdo it. So I think they're just trying to mask it though. So
I've had some patients before where I'm treating their neck and they have perfume on, and then later that night, even though I've washed my hands 5 times, you can still smell it on your hands. So some people don't even realize the power of it.
Yeah.
Moving on to number 6, we have the barefoot person. And this is increasing in frequency nowadays. It used to be really random to see people in barefoot, but with the barefoot movement going on, I think we're going to see that a lot more often. So the barefoot person doesn't care that the floor is dirty, wet, or cold, insists on working out barefoot or in socks.
And I think it's also, again, coming from what you're saying with the barefoot movement, I think it's, a lot of people know that now that, doing deadlifts and squats are always better in a flat shoe. So they just, if they don't have a flat shoe, say that they had Nikes with like massive soles, they would take off their shoes.
Right.
But then that's kind of, it's, now your toes are vulnerable to like, the weights that could be slamming on your own, slamming on your toes.
It's not as safe.
It's not as
work
safe
out
for sure.
Barefoot,
it's not as sanitary.
Not as sanitary
sure.
either.
Yeah.
And again, we're not saying, don't do all of these things, but we're just pointing them out because it's interesting. All right, here's a really interesting one. Everyone has experienced this one. Number 7, the grunter. Do I have to explain this one? Hey, a little grunting is okay. But this person wants everyone in the gym to know how strong they are by grunting as loud as possible.
Yeah, and to be honest, like for myself, I always work out with earbuds. So there's just these few times like I just didn't have a music player at the time. And I'm like, well, I need to kind of calm down my own grunt in there because I don't notice like what I'm doing or even the way that I'm breathing. So sometimes it's good to just take one of the earbuds out and just see.
Listen to yourself grunting?
Yeah.
How's the grunt level? Yeah, for sure. Okay, sometimes the same person could be number 8. This is the slammer. That sound familiar?
Oh, yeah.
Another loud person likes to slam the weights down as loud as possible. Once again, showing the world how strong they are. That's what I think it is. I think whenever people slam stuff down, it's like, hey, look at me. I'm huge. I'm so strong.
Right.
And a lot of the time, they might not be that strong.
Well, yeah. And then, like, I could see how, you just deadlifted this massive weight.
There are exceptions,
yeah,
right?
But, I mean, you could also just put some things under the deadlift so it wouldn't be...
The deadlift dampener,
the dampeners.
pads. They're these little half-moon shaped pads put right underneath your deadlift. And when you drop it, it does not make so much noise.
No.
Now, at the other location I used to work at, Union Station, Good Life, there was someone would go in there and it was so loud with the deadlift slamming and it literally hurt your ears, like physical damage was happening. And it used to really bug me because I'm thinking I'm going to have poor hearing when I'm older because I'm exposed to it when I'm training people on the floor. And like I don't want to be deaf when I'm older because some idiot was slamming the weights down. So
basically be considerate of other people.
Exactly.
Because everybody's trying to work out and some, if you're making a massive amount of noise, you're distracting that person as well. So.
That's right. Okay, so that is the slammer. All right, we have 2 left. We have number 9, the talker. An extremely outgoing person who you sometimes wonder if they even exercise or are just there to chat. I have a friend of mine who, you know who you are. I'll just say BJ is your initials. Yes, have you seen that before?
Oh yeah, I mean, I know for myself, I actually have an amount of rest time. And like sometimes people come and talk, but it's hard for me to not, just to get away from the chat. But you do have like a rest time, so you need to get back to your workout or else you're just going to get completely cold. right? Then you got to warm up all over again, and that just kind of throws off your working sets that you would possibly do, and it could throw off your whole workout.
It can.
So, I mean, keep the chat too.
It is great
Yeah.
to socialize, but it definitely does get in the way of your workout if
Sure.
you're really focused on, doing this kind of spacing in between reps. And, yeah. Okay. And then the final one for today, number 10, it's called the Talker version 2.0. Spends most of the workout talking on their cell phone, oblivious to the fact that others are annoyed at hearing a loud one-way conversation.
And this goes with this, it's like almost like the person that also just texts way too much on the same machine too. It's like other people are waiting for you to possibly use that machine or use that piece of equipment. I understand, like for myself, I use my own phone, but just to keep track of maybe my own workouts, but not so much, like you shouldn't be distracted during your workout. You need to concentrate on what you're doing.
Exactly. Okay, so we're going to move on to our next segment now that we covered that. The next segment is we're going to check in with Dr. Stefan, and we're going to call it Deep Thoughts with Dr. Stefan. I'm actually stealing that from an old Saturday Night Live sketch. So Stefan is my chiropractor friend living in Botswana right now, and he's working for World Spine Care. You can look him up at worldspinecare.org. Anyway, he is sending me random thoughts, deep thoughts, could be on anything. And this one today is going to be related to the next segment, which is going to be a health rant that I have. So this is going to warm us up for the health rant. So it says, "Hey, Dr. Jory, did you know that as we age, our ability to produce vitamin D through our skin actually decreases? In fact, there's a wide variability in vitamin D production and demand. The presence of an autoimmune disease, any type of systemic inflammation, and obesity are all factors that will increase someone's vitamin D requirements. The variations between individuals are so significant that if someone is supplementing, it's best to start with a routine, retest after 2 to 3 months, and then adjust accordingly. Getting your vitamin D from the sun is always better though anyway. That's why I live in sunny Africa, while you are stuck shoveling your car out from under a snowbank." Little dig there.
Yeah, for sure.
And just to let you know, what's the weather like today, Kara?
Oh my goodness, like I've kind of given up. I don't even check the weather anymore. I'm like, okay, the weather's unpredictable. I'm just gonna go out.
It's going to be snow and
Yeah.
rain. So this is like an old school winter that we've been having in Toronto. We're in February now, and the snow just keeps on coming. So Stefan, that was a nice little jab. Thanks for that. And I was shoveling earlier today. But that does sort of bring up the next segment, which is going to be my health rant. I have a YouTube video about it. It's called "Stop Hating on Sunshine." Now, in Toronto in the winter here, we do see sunshine, but can you get any vitamin D synthesis from the sun in the winter if you're in Toronto?
Well, for sure, it's much, much less, of course,
In
right?
fact, it's zero.
Zero? Oh.
Yeah, so from the months of, say, November to March, because the sun is on such an ecliptic plane that the ultraviolet radiation, the UVB, does not get into our skin, we can't get any vitamin D synthesis if you're at a level of Toronto or anywhere else in the world at that level. And what do you think is a good idea then if you can't get it?
You need to go on vacation.
Vacation would be a good idea, or live in Africa
Right.
in the winter. So go to a sunny destination more near the equator, then you can get vitamin D synthesis. If you can't do that though, then supplementation is definitely an option for you. And then another thing that you could consider is actually tanning beds. Now I know tanning beds get a bad name, and rightly so. They can be dangerous if they're not used properly. What you can do though is you could use the tanning bed in very low doses throughout the winter months. And what I do is I go into the stand up or the lie down for, let's say stand up I'll do like 5 minutes. lay down, I'll do like 7 minutes. Now that's a lot less time than most people would spend in a tanning bed. And I actually don't burn very easily. I get very dark, as you can see. And for those who will burn easily, then you have to go even less time than that. So if you have really fair skin, then we're talking like maybe all you need is 3 minutes in the stand-up. Or 5 minutes max in the lay down. And my advice is never ever come close to burning yourself. You should never ever get a burn from a tanning bed. That will definitely increase your chances of getting skin cancer over time. So that's one of the reasons tanning beds do get a bad name, is people use them improperly. They over tan, they do it too often, and they do it for too long.
Right. Yeah.
So the key is do very low doses. I do it once or twice a week and only for about 5 minutes or so each time. And that will raise your vitamin D levels. Is it as good as the sunlight?
Probably not.
Not.
Of course not.
No, definitely not. So
Yeah.
the sunlight is your best source of vitamin D, but living in a northern climate, we don't have that option, unfortunately, in the winter. Why all this hate for the sun? It's the similar reasons to the tanning beds, I guess. People equate sunlight with getting skin cancer. Now, obviously there is a connection. Some people do get skin cancer from too much sun exposure. The key here, again, is not getting overexposure. Everyone's skin color dictates how much sunlight they need. So if you are in the summertime and you have really dark skin, you need to be out in that sun longer than someone who has fair skin to get the same amount of vitamin D synthesis. So it really is kind of on an individual basis. Mm-hmm. But what really bugs me, and the whole reason for this long diatribe and health rant, is how people are saying, like, stay out of the sun completely. Just stay out of the sun because you don't want to get skin cancer. Mm-hmm. And I think, okay, well, let's think about how long have humans, modern humans, been in the sun for without sunscreen? So if modern humans have been around for about 300,000 years, how long have we used sunscreen for? 50 years? So what percentage of modern humans have we used sunscreen? 0.001% of the time. And were all the other people dying of skin cancer, like back 1,000 years, 10,000 years ago, 100,000 years ago, was that a common cause of death, skin cancer? I highly doubt it. So why all this hate on sunlight now? Yes, maybe the atmosphere has changed because of chemicals that we put up there. But the point is, we need sunlight, and vitamin D synthesis is key to our health. Vitamin D regulates, I believe it's over 1,000 genes, so you need to have adequate supplies of vitamin D, and the sun is your best way to get it. Okay, Kara, so now that I've got that out of my system, I was thinking maybe we could talk a little bit more about what you offer from a massage therapy standpoint.
Okay, right. So I do cupping. So cupping is something that's not a new thing. It's been around for like the longest period of time, but it just came into the media.
Like, are we talking thousands of years?
Yeah, I'm pretty sure
Okay.
thousands of years, and I'm pretty sure it comes from either Chinese or Asian origin. Mm-hmm. So cupping is pretty much a technique that you may have seen in the media nowadays with Michael Phelps. You've seen the Olympic swimmer, you see those marks on him, and I think at the time people thought, okay, that must be an illegal type technique to be using the Olympics. So cupping is a technique where you pretty much use certain cups, usually plastic cups, or it could be glass cups, to actually suction areas of your body. And what you're trying to do is you're trying to lift off something called fascia, which is a thick connective tissue that's underneath the skin, surrounds our whole body. It's kind of like a sweater that's all around our entire body that sometimes gets snagged. So what we're trying to do with cupping, we're trying to pull those snags apart so that you feel as if your body just feels way looser and more, you can also increase range of motion and things like that as well.
Right. Less restriction.
Less restriction.
You could think of it maybe as a tack. Like a little thumbtack has been stuck in your fascia, and so now your fascia is not moving as well. So you're trying to remove that tack, and then you get full fascial movement.
Yes, and like imagine again if there was a snag on the fascial sweater, how that can affect other areas of your body as well. So that fascia could be pulling on, say, if it was some issues around your forearm, that could affect your shoulder, could affect your thoracic, your chest. Further down in the body, just because of how connected fascia really is.
Right, and there are other treatments for fascia too. I use ART, or I call it JRT, Jory Release Therapy. And then there's fascial stretch therapy, and then there's cupping. So there's lots of different ways. There's rolfing, which is the really intense, aggressive. Speaking of aggressive, I would say that Kara, you do have good pressure. I've had massages from Kara, and she really gets in there, and maybe part of that is because you're so strong from all of your weightlifting.
Yeah, and I think it also just comes from years of doing my own mobility for myself after my workouts, just using like lacrosse balls and foam rollers and things like that to really dig in those areas.
Right. Okay, let's kind of wrapping this up, but I want to circle back to workouts, and maybe you could tell our audience what exercises would you say, if you could only do like 3 exercises, what would you say are the best for your body?
Right. I would say for a lot of people, they are in a sedentary type of job and things like that, where they're sitting all day. So for a lot of people, they tend to be a little bit way too protracted. And so a lot of people like to focus on like maybe working the pecs, but not to say you can't work pecs, but we need to kind of bring back those shoulders somehow.
Balance.
Exactly. So like if you wanted to do a bench press, that's fine. But I would suggest a lot more pulling and so retraction type exercises instead, or in conjunction with it, but just maybe a ratio of 3-to-1 or 4-to-1 from more horizontal pulling compared to push movements.
Perfect. Now I can actually speak to that. When I was in grade 9, when I first started lifting weights, and I can tell you that all boys and men do this, is once you first get in the weight room, the first thing you want to do is bench press.
Yeah.
You've seen it on TV, everyone knows about bench press, so you start focusing on bench press. And what happens is, you get a nice strong chest, but then you do this. And that's what happened to me. So I was kind of stuck in that protracted situation. And it takes a lot of work to pull yourself out of that. I would say that I'm still working on it to this day to try and get the shoulders back here. And it does involve a lot of retraction. Right. Pull downs, lat pull-ups, seated rows. Yeah. Any kind of pulling motions, pull-ups.
Yeah. So we also want to concentrate not so much only on just the lats as well, because lats can also internally rotate the whole arm here. So, but we also just want to do a lot of horizontal things as well, like just retraction and rhomboid type
rhomboids and middle traps.
Yeah, middle traps, where we're trying to bring the 2 shoulder blades together. Pretty much.
Instead of having like this, you want to bring those shoulder blades together.
Yes.
Yeah. Any other exercises that you would recommend if you could only do a couple? What would be most important?
For sure, a lot of people lack core stability. So I like core workouts where you're focusing on anti-rotational type movements. So not so much just like crunches and things like that, which will work in your rectus abdominis, but maybe things like planks where you're trying to keep everything stable. So you're not twisting and things like that. And that's where a lot of people get injured with their lower back, is like lots of twist movements or lack of core. So anti-rotational type core exercises, I think, are the best of all type of core movements as well.
Right. What about if you could just choose one exercise that would work almost every muscle in your body? What do you think?
I say for sure a compound movement.
So what's that mean?
So compound, it's opposite of like an isolation type exercise.
So here's an isolated exercise.
Yeah, it's
right?
kind of like you're kind of only using one joint.
Like a bicep
You
curl.
can't usually work one muscle in isolation per se,
Right.
but you're trying to focus on the bicep.
So
on
give
this
us a good compound.
So
movement
like a
then.
squat. Squats are great.
Squat, you're using all kinds of muscles.
You're hinging at more than one joint, and you're using lots of muscle groups all at once. So it's more bang for your buck. And for a lot of people, we only work out for maybe an hour. But with a compound movement, we're working out lots of different muscle groups. And so you're actually using way more energy and calories than you were to just do a bunch of bicep curls for like 10 minutes.
So you'll see, when you see me work out, which isn't even close to as often as you're working out, but when you see me work out, you will never see me doing isolation type exercises because I have such limited time. I'm focusing on what is the best bang for my buck.
Right.
I'll be doing decline presses, lat pull-ups, chin-ups, push-ups, deadlifts. That's pretty much my workout.
That's
It takes me
almost
like 20 minutes
Yeah.
and then I'm done. I just go hard
Yeah.
and then I'm done. And I also try and ride my bike as much as possible. I try and ride to work and back, but with all this snow, it's impossible. All right. Well, to wrap this up, let's maybe ask if you could give any sort of tips for better health, whether it could be anything. It could be nutrition, it could be lifting weights, anything at all. Something maybe that's not, common knowledge that everybody already knows.
Well, there's a lot of things that people, I think, don't do that it may not be unique, but just moving in general will help you in so many different
Movement.
ways. Yeah, it's not even,
That's it.
it's not even like I gotta like lift this many pounds at the gym. It's like getting up from your desk and things like that. And it sounds like this is not that unique, but it's crazy how people don't think that will help them that much, or how just getting up from your desk at work for once an hour would make a big difference than just sitting there for several hours and then going to the gym at the end of the day.
Absolutely. And although, is that unique? Hard to say, but that is such good advice, and people need to be told that over and over and over again because they don't listen or they forget.
Yeah.
So most people will forget, and you sit there at your computer all hunched over for 3 hours in a row, and guess what's going to happen to your tissue over time? Over time, your tissue adapts to that crappy position, and now you've got to put in years of work to try and get yourself back in a normal position. So yeah, sitting is the new smoking, as you've probably heard of, and that's also why I tape all my podcasts standing up.
Yeah.
We don't sit. Even though I've had 4 knee surgeries, that's how we roll. Now there's one last segment I forgot to put in, which is called Random Injuries. Okay, when I was about 5 years old, I was in the basement and my parents had some kind of family gathering. So my cousins were over and we had a dartboard, so you can understand where this might be going. And we're playing darts, 4-year-olds playing darts, it's pretty safe. And I went up to take the darts off the dartboard, and my cousin threw a dart and it landed right in my face. I actually have a little hole right here where it landed.
Is this bad? Is this bad? You should pull that out. That shit is not cool. Wait. Pull it out. The dart, man. Got a fucking dart in your neck.
So the dart popped right through my face, and I ran up to my mom upstairs, and it was dangling like this, and it horrified everyone. They're like, "Oh, what is that?" And so she pulled it out. It hurt so bad when she pulled it out. But also, when I think back, it probably had like a bit of rust and stuff on it too. So anyway, I don't think I went to the hospital or anything. I think it just maybe had a little scab there, and to this day I have a little hole in my cheek from a dart.
Man, now that you say that, I have such a similar story.
You had a dart in your face.
Kind of. What I did is I hung up a bunch of cans, like Coke cans or Sprite cans, strung the tabs along like 2 trees. And my little brother and I,
Wait. How old are you here?
I would say 8 or 9.
Yeah.
And so we made homemade bow and arrows out of wood and like long sticks. And we decided to put nail heads at the very end.
Uh-oh.
And I thought it would be a really great idea if my brother and I, we went on either side of this thing that we're stuck to the tree so that we can pick up each other's arrows right away. So basically we're shooting at each other.
With nails.
With arrows with nail heads stuck to the other end.
Wow.
But I'm like, yeah, this is ingenious. We don't have to run to the other side. But my brother got me with one right in my hip.
Oh,
I'm pretty sure.
Your first exposure to acupuncture.
Yes. Hopefully, acupuncture does not hurt.
Yeah.
So, but yeah, for sure, it was hilarious. I don't think I told my mom, but.
Wow. Thanks for sharing. All right, well, we're going to wrap this one up. So, as usual, if you liked it, hit that subscribe button right over there and give me the thumbs up. And we will see you next time. Until then, get your health on.